We are going to go over the 5 L's of lifting. The 5 L's are load, lever, lordosis, legs, and lungs. The first L is load. When you go to pick up an object, you are going to pick up an object that's light differently than you'll pick up a heavier object. Your brain kind of figures out, this is going to be heavy, I need this amount of force to lift it. The second L is lever. That's how close you hold something to your body. If you hold your arm out or the object out this far, it's almost twice as heavy as if you hold it close to your body. So we hold heavier objects close to us. The third L is lordosis. That is the normal curve of your spine. When you are lifting objects, you keep your spine nice and straight. You do not lift objects when you flex over like this. You keep your spine nice and straight. The fourth L is legs. In order to lift an object, you have to use your legs. You bend down to get the object and you lift it straight up. You use your legs to lift, not your back to lift. The final L is lungs. Just before you go to lift something up, you should take a big breath in, and as you lift it, you should breathe out. This will help decrease the interdiscal pressure in your spine and prevent further back injuries. We're going to go over a trapeze setup today. There are 3 main parts of the trapeze: the offset bar, the telescoping bar, and the straight edge bar. The offset bar goes to the head of the bed and inserts into the IV pole holders. The straight edge part goes to the foot of the bed and also goes into the IV pole holders at the foot of the bed. The telescoping end, you want to hook to the top right here. You want to make sure all your knobs are nice and tight prior to patient use. The trapeze part needs to be chest level to the patient. For shorter patients, you want the trapeze bar to be as low as possible, and for taller patients, you can adjust it so that the patient can actually reach up and pull on it. Make sure all your knobs are nice and straight, and you give a nice tug on it to make sure it is secure prior to patient use. Next, we're going to set up traction for a patient. The items you need for traction are the boot, a rope, the traction setup, and a weight. First, you apply the boot to a patient's leg. You take about a yard of rope and you want to secure it to the foot plate of the boot. You tie knots, and then you want to tape the rope because this rope is very prone to fray. You feed the rope through this area right here, which is between the trapeze and the footboard, and you feed it through the pulley. At the end, you want to make a loop and tie it real tight and tape this because this rope is fraying. The weight will be in order, and it will be in the chart on how much the physician wants on the traction. You take the weight, put it in the loop you created, and lower it down slowly. You want it between the floor and the bottom of the foot plate. So you want to suspend it about right there. You don't want the weight to be suspended even with the footboard, because if someone passes and this bumps into the foot plate of the bed, it's very uncomfortable for the patient. If it's on the floor, you're not getting adequate traction for the patient. So again, you just want to have it suspended between the bottom of the footboard and the floor.